So Kaiser Permanente was using tracking software within their browser sessions on a lot of their web applications, and these implemented tracking solutions were, I'm assuming, to help them with analytics on the back end. But anybody who's ever implemented or installed analytics software knows that it captures a significant amount of information um, from users in order to store in the analytics portal or the analytics database that is being used. Now, what was happening was Kaiser Permanente is responsible for health insurance and Portability Act data, the HIPAA data, that is sensitive to individual medical patients. As medical patients were logging into these Kaiser Permanente services, their tracking software was consuming potential medical data. So they're notifying patients of a data breach, but it's not a data breach in the context of a number of hackers were mining data from their website. The data breach is their own doing. They set this up, they installed the tracking software. It was designed and implemented with their full knowledge. It wasn't something that was nefarious, it was something that was hilarious. So I'm not sure what the ramifications of this are going to be. I'm not sure if they're going to be opening themselves up to a lawsuit or if there's going to be a class action against them for this breach, but it is a breach. It's a breach simply because of the fact that they funneled data to a third party in order to generate data for advertisers. Now, I'm assuming they're, like in this article, it says that it's sharing patients' information for advertising purposes, but I'm guessing they were doing it for analytics. If I had to imagine on a let's say I'm being overly optimistic. If I'm overly optimistic, which I like to try to be, and I really ought not to be given the state of things. If I'm looking at this with bright eyes and a bushy tail, I'm going to say that they only were absorbing data for analytics purposes and they wanted to be able to understand their deployments and be able to generate profiles that would allow them to expand and provision better. But it says right here in the article that they were sharing with third party advertisers, including Google, Microsoft, and Twitter. So it could be, now, this is just me saying based on this article what it could be. It could be that they were actually selling data to advertisers. And I cannot fathom in what universe any CTO at any medical institution who is certified and accredited, which they all have to be, could look at this. And I'm sure Kaiser Permanente has a CISO as well as a CTO. I'm sure their conference would strongly disagree with the idea of selling patient sensitive data to advertisers. I have to believe that this was some sort of a slip up. Um, if I'm going to view this through a darker perspective, I could say it was intentional, but I'm not going to because it doesn't make any sense really. So yeah, data was shoveled from Kaiser Permanente to third-party providers through website tracking data, and yeah, personal health information was shared with advertisers. Now, the reason that this is a net negative is that this data, once slurped up by advertisers and advertising companies, it's never expunged. I would I would highly doubt that they would take useful information such as this personal health information, which is absolutely useful from an advertising targeting perspective, and simply destroy it. Like without a court order, I can't see them destroying it, even if it opened them up for potential later lawsuits. But I don't know the details internally. At they don't even um, they don't even specify exactly which advertising providers. All they do is they give us a list of a few. I'm not sure if these are explicitly all of the providers. Um, but I can't see them taking that useful data and then just deleting it arbitrarily. So likely that data is going to be preserved for a specifically long time, and it will be on the internet and rip Kaiser Permanente users. Kaiser Permanente is a very large medical institution. They maintain hospitals. There's a good possibility that a number of you are actually using them as an insurer. So hey, this is happening. Wake up. Okay, that's it. Goodbye.